Today's going to be a little more interesting than my other lectures. We're going to involve some audience participation so we all can have fun. So I'm going to ask those of you who are in the back just to kind of move up so we're all one big happy family. Don't be shy. Thank you. He left. I always get asked a lot of questions. By the way, let me introduce myself. I apologize. My name is Dr. Alex Shvartsman. I'm the owner and the medical director of the Center for Healthier Dentistry on Long Island. Excuse me. I'm a holistic dentist. I'm also a naturopathic physician. So in my practice, we have a very interesting approach to dentistry. We integrate really the best of modern dentistry, modern technology, materials, and techniques with a healthier approach to dentistry using a more natural approach, an approach that is more in harmony with nature. And I will tell you, since I've started this journey about 6 or 7 years ago after I became mercury toxic and sick, I have become a much more effective healthcare provider than I ever was. You know, this integration of natural, holistic approach into dental care, I think, is vital. And the questions I get asked a lot has to do with a lot of the materials and techniques used in dentistry that are toxic. And I just want to ask anyone a question. Have anyone here ever heard about root canals being a controversial subject? Okay, about half the room, more than half the room. So today I'd like to kind of answer some of your questions about root canals because it seems to be one of the most common questions I get asked. People, who are health-minded understand that mercury is not a healthy material to have in their bodies, contrary to the recommendations of my profession and our government. So root canal seems to be the most controversial thing after that I get asked about. So for those of you who raise your hand, would you mind sharing with me what have you heard about root canals that is toxic? So raise your hand. Shoot.
I just heard about it today.
You did?
I have had a few root canals, so now I'm very concerned about
what are you concerned about?
Whatever the negative effects are.
Any negative effects you're concerned about?
Yes.
Smart. Do you have any specific effects that you've read about that you're concerned about?
Well, I found out over the course of time that root canals open the body up for contagion of one sort or another.
Right, exactly. So one of the big things about root canals is that the bacteria is left in the tooth and it leaks out of the tooth and gets into your body and causes all kinds of health-related problems. And so it's one of the things people talk about. Anything else besides bacteria left in the tooth?
I just recently read something in reference to apple pectin, sealing it. Is that a fact?
Right. And we can get back to the apple pectin, but right now we're talking about the ill effects of root canals.
Okay.
Thank you. So any other ill effects that you guys have heard about?
Specifically the anaerobic bacteria that concentrate in the tubules of the teeth and then outline rate of the rest of the body.
Exactly. Right. So again, the bacteria issue. Right. Any other issues? Right. But besides the bacteria, we've all agreed there's a bacteria issue with root canals. Are there any other things that you guys are concerned about? I want to get a sampling of the public that's here. What other concerns you have about root canals, so I can answer them for you.
So they said, I had one done, and then, I did my cleaning, whatever.
Right.
They checked it, and they said I have to redo it. There's a black spot. Why?
Right. Well, that's back to the bacterial problem. So what?
But it wasn't paining or anything. It was fine. I told they wanted to make more money than me.
Okay. All right, so let's talk about the bacteria issue because, yes. You have anything else besides infection?
Right.
Good. So another concern is the materials that are used inside the tooth that can be potentially toxic and also leading to some possibly harmful effects to the body. Okay. So, as you saw, we could all agree that the bacterial situation seems to be the biggest problem that people are concerned about. So, I'm sure many of you have heard or read on the internet that bacteria can be left in the tooth. And it sounds very scary. And in fact, it's not very far from the truth, and it's basically true. And the reason for that is what you mentioned earlier, is that, so I wish we had a screen here, but we don't. So otherwise I'd show you some pictures. But imagine in your mind a trunk of a tree with roots branching out. Okay, so you have a main trunk and you have these branches. So the nerve of the tooth is built exactly the same way. There's a main trunk and there's all kinds of branches coming off. And the problem with conventional techniques of dentistry, which haven't changed all that much since about the early 1800s, where you would stick a needle inside the tooth and pull out the nerve. And then the biggest advance has come in using basically Clorox bleach to bleach out the tooth and hopefully kill all the bacteria inside the tooth. And for those of you who've had root canal therapy, you might have smelled Clorox bleach around your head. And that's because, shamefully enough, most dentists use Clorox bleach to rinse your tooth out during root canal procedures. Now, you can buy it from like a medical company, but I've seen a number of dentists who actually buy Clorox bleach from like Wallbounds. So that's basically the kind of the state of the art well, I should say state of the art. That is basically what happens during root canal procedures. A long needle is taken out to remove the trunk, and you hope that the Clorox bleach will eat away at the remainder of the nerve, tissue, and bacteria. But there's a bigger problem. The tooth is actually made of billions of microscopic tunnels called tubules inside the actual dentin, the hard part of the tooth, the root. And bacteria could reside, they're small enough to reside inside all those billions of tubules. And the problem is that Clorox bleach doesn't get all the bacteria all the time, or arguably none of the time. Well, maybe some of the time, because some conventional root canals do actually work. So what we have found through using new 3D digital x-rays is that root canal reinfection is a very, very common problem. We see so much more infection now with new digital x-ray technology that's 3D than we ever have using two-dimensional x-rays. So a lot of dentists, when they take x-rays and they don't have a 3D digital scanner, they're missing all these infections. They think their patients actually are walking around without a problem, or in fact, there's a abscess, that dark shadow you talked about. That's basically an abscess around your tooth, or a tooth, that's full of bacteria. It's basically a pus pocket of bacteria around the tooth because all these toxins and bacteria are leaking out of the tooth because they were left inside. Not on purpose. I can assure you, dentists want to help people and they want to cure these problems. It's just that maybe the techniques associated with treating these problems aren't really as good as they could be or they should be. But let's face it, in the past 100 years, there have been many improvements in health days. But as far as technology is concerned and techniques, things have improved. So the main problem is the conventional approach to root canals doesn't solve the problem fully. So what if I told you that today, in 2016, there is an approach to solving this problem, and it has a lot to do with using some modern technology as well as some alternative medicine. So in my practice, I treat a lot of very sick patients who have a lot of environmental issues, a lot of toxic issues, where conventional medicine can't really help them or doesn't help them. So they're very concerned about the toxic materials used in our body. They're very concerned about the root canals harboring bacteria and dumping all this toxins and bacterial waste products and bacteria into the body so it doesn't circulate and cause damage. So in our practice, we developed a really revolutionary approach to root canal therapy. we use a new laser. Well, it's actually not new. It's been around for about 10 years, but a recent laser that what it does is it creates a sonic boom, a shock wave inside the tooth, and it bursts all the germs inside the tooth. And this is the only technology that actually goes down to the microscopic dental tubules. And there's been many studies to show that to be true. So it's been proven scientifically. There are electron microscope studies showing all the tubules being completely clean before and after. So this technology works. Why doesn't everybody use it? Because the laser is over $100,000. So most dentists may not want to reinvest back into their practice and spend $100,000 on a new machine. Otherwise, I can't imagine why people wouldn't use this technology. So in our practice, because we use alternative medicine in addition to modern medicine, modern dentistry, we, as part of our protocol, we also use ozone therapy. We use ozone in an ozonated water form to rinse out the tooth. We also, after we dry the inside of the tooth, we fumigate the tooth. We flood it with ozone gas, which also can reach the dental tubules. So we have multiple ways of disinfecting the tooth. If by some strange reason the laser left one bacteria in the tooth, I know we have other means to address the bacteria problem. Yes, sir.
So, and you're saying that's your method of treatment. So, if you have had treatment from another dentist who has not done the extensive cleansing, can you treat that, and can you observe it through your technology?
Great question. So if you have a root canal done before and it's infected, can you take everything out and re-sterilize the tooth? And the answer is yes. In fact, 75% of our root canal therapy that we do is doing exactly just that, is redoing failed or infected root canals.
Do you have to take the cap back off?
Sometimes you got to take the cap off, but most of the time if the cap is fitting properly on the tooth, we can create a small hole on the top of the tooth, get down to where we need to get down to, and then seal the crown up. That way, not incurring additional expense of a new crown, which is probably your concern, and rightfully so. Yeah, you know, don't fix what's not broken, basically, right?
But if it's not causing a problem, then can you still find a problem with it?
Yes, yes. Mercury in the teeth. That's a whole other subject. You want to switch subjects? Or should I finish the root canal story? Okay.
How do you get into all those microtubules because they could be really filled up with whatever the previous
It's a great question. The laser actually cleans it all up. And the truth is those tubules aren't really sealed. They were never really sealed to begin with.
But that means bacteria will get in them again then if they're not really sealed, even if you use your
No, well, the final finishing seals the tubules. But you asked a very interesting question, which I get a lot also of. The bacteria somehow will crawl back into the tooth after the tooth is hermetically sealed.
Right. So even
How does that happen?
because there's always little crevices.
Where? Oh, in the tooth.
Yeah.
But we just killed all the bacteria.
Yeah, but they could re-enter into any openings.
From where? Which openings?
Because the sealant that you use to plug it up could be brittle and break up, creating new crevices.
How do you know it's going to break up?
Because nothing lasts forever.
Nothing does last forever, not even our teeth. It's terrible. Well, that's a very interesting point, but the material that we use to seal the tooth actually fuses with the tooth structure. It actually bonds organically because it's made up of very similar crystalline structure as a tooth. So I can't even imagine that happening.
Can you describe your material?
We use a bioceramic sealer.
And it chemically bonds to it.
Yes, it organically bonds to the
So
tooth.
are you using different materials than most dentists?
I'm using materials that's available to all dentists.
Yeah, but what fraction of them use that?
It's a good question. I have no idea. I never did that survey.
Is it very few?
I have no idea. I never did that survey. But I will tell you, there are literally hundreds of sealer materials one can use, and they're all being used throughout the country and the world. So you're probably right, only a small fraction, and by the way, it's expensive. And dentists don't want to spend money, right? So it's a very expensive material, but that's what we use because my ultimate goal is to provide my patients with something that works and lasts decades, if not their lifetime.
Can I ask you another question? Let's say I've had root canals. I'm not having any obvious problems.
You have no pain.
I have no pain right now, but would it be a good idea to have like a checkup where you come in, you can get it blasted with your laser shockwave just to kill any bacteria that might be there?
It doesn't work that way. It doesn't work that way. That'd be cool though. You know, ozone gas works that way though.
Yeah, but you have to open up the tooth to do it, right?
Oh yeah. Yeah, you have to disinfect the tooth first. It all comes from the tooth. It's like, you know what it's like? Imagine a faucet that's being always on and it's dumping bacteria in your body, or filling up your bathtub, and you're scooping up the bathtub. But unless you turn off the faucet, you'll never get anywhere. So you ultimately have to have a fully disinfected and hermetically sealed tooth. And you know what happens after that? The infection disappears. Because our body wants to heal. Our body is always healing. Our body is always trying to heal it. And we are always putting barriers in its way. You know what I mean? Not you personally, but like, you know, the environment.
What I've read about root canals is you can have a low-grade infection that your body's fending off with its immune system, but it's taking its toll on the immune system. So even though you don't have any obvious problems that you know about, over a period of time, you know, that's wearing down your body's defenses so that eventually...
Are you a doctor? Because I gotta tell you, that is exactly what happens. I talk about this all the time. You couldn't have said it any better. You know what he said? When you have an underlying infection in your body, and your body's immune system, very powerful thing, is keeping it at bay, it's obviously taking a toll on your system. And if you have too many infections, you got a cancer here, you got an infection here, you got this there, you're right. Eventually, our body runs out of raw material, cells, immune cells, all that stuff. And yeah, and that's I think what happens when people get sicker and sicker. Eventually it takes its toll.
Well, then what do you do if you don't have any obvious problems and you have all these root canals? Now, you know.
Great question, right. And basically what I told several of you throughout the day, it all begins with a diagnosis. You cannot manage what you cannot measure or you cannot identify. So a lot of you have come to me today and you asked me all kinds of questions. And I can't really answer them because I need to do an examination and I need to really see what's going on for real in your individual case to tell you what can be done. Otherwise, I'm just guessing away. So there's a technology that we use to do exactly what you just said, to get that diagnosis. And that's a 3D X-ray. It's a newer technology in dentistry. It has the diagnostic value of a CAT scan without the radiation. And with today's digital technology, at least with my machine, the radiation exposure is about 1 week's worth of natural background radiation that we're being exposed to on a daily basis. In other words, it's within biological limits. So the amount of radiation you get is minimal and possibly even insignificant for the amount of information you get, which is you see the pus pockets, the dark holes that this lady mentioned on the X-ray. Except in 3D, you could really see what's going on clearly. You can identify these problems readily. And so if you have these black shadows around the roots of your teeth, you definitely have an infection. So that's happening. If you had a root canal done and the bone looks completely healthy around the tooth, well, the body's not reacting, the body's not responding. If you have toxins and bacteria leaking out constantly, the body would respond, but it doesn't. So another technology which we're looking into, I've had send some patients for, is thermography. But it's not like precise. It's I don't think it's really there yet, but I do think it has an added value in diagnosis. And it gives us just a little bit of information. The truth is, the more information the doctor has, the better they can help you. If they have complete knowledge of what's going on with you, they can give you a complete treatment. But if they have partial knowledge, they can't give you a complete treatment. So diagnosis is the key to everything. If you nail the diagnosis, you could begin helping people. Yes?
What other methods of, you mentioned that you're a naturopath also?
Yes.
So does that incorporate the dentistry part or other?
Okay, I'm a dentist first. I studied naturopathy to improve my dental care to my patients.
So how do you incorporate?
Well, there's a lot of things that I've learned. You know, that's a discussion for another time. That would be a very, 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 very lengthy discussion to lay out for you everything I use from naturopathy and dentistry. But suffice to say that I've added a lot of things from the holistic world, the alternative medicine world, into my dental care to improve it, to make it less toxic, more minimally invasive. So, yes.
Another question. With that black, whatever, shadow around it,
Yes.
does that cause your cap to fall out easily, or your cap falls on other reasons?
Okay, so there's a black shadow causing the cap to fall out.
No.
It's a good question. If you, the black shadow is actually a hole in your skull of liquefied bone, which means there's no bone there.
Right.
So if the infection is there long enough and it eats away all the bone around your tooth, your cap and your tooth will fall out. Yes.
My cat fell out.
Your cap fell out? There's a million reasons why it did. This may not be one of them. Don't think of the scariest possible thing.
No, but I need that part examined as well.
Yes. Can I talk about implants? Okay. Is everyone satisfied with our root canal topic? Do you have any other questions on root canals?
We need to see you.
So if you have very old root canals,
Yes,
should you still get an exam to see if there's something going on in there?
I would. If all you've been using is two-dimensional x-rays to evaluate those teeth, and you've never had a 3D scan, I think it's a worthwhile endeavor. Because I'll tell you for a fact, until I got the 3D x-ray machine, I couldn't believe how much more disease is out there and how my patients are walking around silently with disease. The problem is, it doesn't always hurt. And so our only perception of what something's wrong is pain. You know, that's the kind of the universal, well, not the human at least, or the animal, feeling of something's wrong. It's like an alarm system. And in fact, that's what nerves and teeth are. The nerve is just an alarm system for the tooth. When you take the nerve out of the tooth is still a tooth. It's still in your mouth, it still functions like a tooth. It chews like a tooth, you can speak with it, you can whistle with it, you can bite with it. So I'm gonna finish off this little talk on root canals with one last thought. Another thing which no one mentioned to me today is the dead tooth issue, right? Oh, the dead tooth, yes. My favorite. So the dead tooth is really more a problem of nomenclature or words than reality. Basically, dentists began calling teeth dead just as a short way of explaining to people what's going on, because they didn't feel probably taking the time to explain what's going on to people, and just saying it's a dead tooth and you need a root canal was just much faster. Okay? And then some people took this dead tooth verbiage and they made it into something that it's not. So what people tell me all the time is, well, if I have a dead body part in my mouth, that's bad. You can't walk around with dead body parts, they're dead. And that's awful. Can't have anything dead in my body. No way. Okay, that makes sense. The problem is you have two other dead tissues in your body that you all seem to be very happy with. It's the hair on your head, or your face, or your nails. They're dead tissues. But none of us are ripping our head and nails out anytime soon, right? So the thing with dead is, it's not really a dead tooth. It's just teeth have very unique structures, by the way. It's a solid, condensed bone structure in your jaw that is used to chew food and speak with. When you take the alarm system out of the tooth, you take the ability for your brain to feel there's anything wrong with your tooth, like a crack or a cavity, okay? But the tooth is still a tooth. You can still reconstruct it and use it for the rest of your life. That's the problem. It's just verbiage. The problem is having a tooth that's full of bacteria in your mouth. That's a problem. Not a word. So just be careful people taking something and running with it in the wrong direction. Yes? I can't hear you.
Can you see the tooth that is infected behind the bacteria with a 3D scan?
Yeah, well, you don't see the I wish. Let me tell you something. If there was a technology to I can look inside a tooth and actually see the bacteria without ripping the tooth out, that would be something. That would solve a lot of our problems. Then the diagnosis would be easy. Unfortunately, no one's invented this technology yet. I'm still waiting. Up until that point, all I have is a 3D X-ray. That's the best in 2016. And what the X-ray shows is basically a hole in your skull around the tooth, an infected pus pocket. And when we see that, the diagnosis is very simple.
Are these technologies covered by insurance?
No, insurance company didn't give me money for these machines, no.
No, not for the machines, for the treatment. Because I have insurance.
Oh, okay. I don't really know about your specific policy to answer that question, but insurance companies, the insurance questions are very interesting. The problem with the insurance question is each policy is different. So your insurance may cover it, yours will not. And the problem is your policy. If your insurance covers 3D X-rays, then it'll cover it. You know what's happening? As this technology is being used more and more insurances are, and it's really based on a policy. So, that's a more interesting question. How much does it cost? Normally between $500 to $750 for the 3D scan. In our practice, we charge only $200. Mainly, I want my patients to know what's wrong with them first, and I don't want the diagnostic portion to be prohibitive, because people really should know what's wrong with them so they get good healthcare decisions about themselves.
Is that for the whole mouth or just a particular tooth?
That X-ray covers the whole mouth. And we actually throw in the little 2D X-rays along with it. So you can have a really thorough X-ray examination for $200 in my office.
Where are you located?
Yes. Sorry?
Your location?
Oh, I am in Smithtown, Long Island. Just a short train right away. Which is actually pretty cool because we have patients traveling from around the country, and the California people would love to be an hour away by train.
That's true. Central Islip?
Is it next to Central Islip? I think it's like 20 minutes.
Further north? Further east?
East. I like the fresh air.
It's north.
45 bus.
Talk about the implants.
Oh, implants. How much time do we have? I could talk all day, honestly. Yes. None. A tooth that's been crowned, actually, I'm lying to you. It depends on the crown. If it's a metal-based crown, you can't see through it. If it's a porcelain crown, you can. So, yeah. You see roots in just a blob of white. It's all masked out. Yes? We do remove mercury. Yeah, I'm actually, and I'm embarrassed to tell you this, I'm the only accredited dentist on Long Island who is accredited on safe removal of mercury fillings. And I think there's one in New York City. There's like 2 of us in this area. It's crazy.
It's an Astoria.
Yes.
So that means you have the oxygen and everything.
Yeah, I have all the stuff. The problem is there's a specific protocol that's been designed by the International Academy of Oral Medicine Toxicology, and the problem we have I'm actually on the accreditation board of the academy and on the educational committee. So we have, the problem we have is we have a lot of people coming into our meetings and like yell at us that they went to a member of our organization and the patient knew how to do it better than the dentist. And people get very upset. So the IMT created an accreditation process where there's a review board. You got to take like a board exam in mercury science. You have to stand in front of a basic committee and go through a slideshow presentation like this, talking to people, show them exactly how you do it. You basically get vetted by your colleagues who know how to do it right. And so, and unfortunately those dentists are far and few in between, because if you're not accredited by the IMT, you're just doing it whichever way. Now you could be doing it right, and I hope they are. But a lot of them aren't, because we get a lot of complaints. Yes?
Yeah, I just want to mention, I'm a patient doctor, and I did all my mercury fillings, and I've done quite a bit of research before I came to doctor.
This is not a paid advertisement. It's very important for you to say.
Okay,
All right. Yeah. Thank you. I appreciate that very much.
So I just want to say that I was so satisfied with the treatment. It was done safely and no pain. Stuff is comfort, no pain. So
Thank you.
I'm totally thankful.
We'll pay you later. Yes, sir. Say it again. Implants.
Yeah.
Okay. Do we have time? Until they throw us out, I'll just keep talking.
I think like 15 more minutes at least.
All right, cool. Implants.
15 minutes.
What would you like to know about implants? Materials. Okay, good. So, who does not know? Well, actually, I'm not going to ask that question because no one's going to raise their hand. But let me tell you what dental implants are, in case you don't know. Dental implant. You ever heard of like a prosthetic hip replacement? Like when your hip is bad and it can't be fixed or healed, you get a new one made of metal. Okay. So that's called a prosthetic hip. So dental implants are prosthetic roots. So your tooth has two parts. 2/3 of the tooth you don't see, it's in bone. It's in the bone via a root, which is an anchor. And the white part, the little white rock that sticks out, is the other top third of the tooth that's used to chew it. So dental implants are the root replacement. It's the artificial root onto which you put a post and then a cap. So imagine your mind. I wish I could draw it, but it's a 3-part system. So you, as the person who's missing a tooth, would want a tooth. But a dental implant is the anchor for that tooth. Now, a lot of people, when they say dental implants, what you mean is the tooth. You mean the whole thing. So just picture in your mind, just the dental implant is the root portion. It's like a cylinder that goes into your jawbone. And right now, there's 2 materials that are available for this procedure. And these 2 materials have a very interesting property. They're so biocompatible that your bone, your living, breathing bone, literally fuses to the material. It grows into it through a process called osseointegration. Osseo means bone, integration means integration, like fusing. So bone fusing is the process that occurs. So one material, and the material's been used for, I think, about 85 years now. So we have almost 100 years of research on it. This material is called titanium, which is a metal, okay? But it's ridiculously biocompatible that your body literally grows into it. So, like I said, it's been around for almost 85 years. There's a ton of research on it. It is a very, very predictable procedure. It has a success rate between 92 to 97%, depending on the studies that look at it. And with today's modern surgical techniques, I think those percentages can go to 98 to 99% success. So we have a lot of background on titanium. It works really well. It's actually being used throughout all medical fields. Whenever you implant metal into the body, it's for the most part titanium because it's so highly biocompatible. That being said, we do have a number of patients who have a problem with metal in general. Some believe it causes magnetic fields, although titanium is not magnetic. Some people believe it interferes with your chakras and your meridians. But the point is, they don't want metal in their body. And I can understand that. So fortunately, we have a new material called zirconium, which is, now zirconium is a metal. It's actually a radioactive metal. But through a process of oxidation, the titanium is converted to a metal-free substance called zirconium is converted to zirconium oxide, which is then compressed into, and it looks like white glass. And if you look at the periodic chart of elements from high school, titanium and zirconium are in the same column, which is that they share a lot of the same properties, one of which being the body loves it. So now we have a material that's solid, that behaves a lot like glass, but it still has the metallic property of zirconium to fuse to the bone. The problem is this: it's very new. It's been around for 10 years in Europe, about 5 years in the US. And so the research isn't as extensive, and what seems to be the issue is that the success rate of these implants of fusing to the bone is about 85%. It's less, which is kind of a problem. So if you are completely against metal and you're willing to take a decreased success rate, you can have zirconium. And we offer both in our practice. I will tell you, I'm going to share something personal with you. I lost a tooth. I did an olive pit one day and it cracked my tooth in half. It was extracted, bone was grafted in the area, and I received an implant. Mine is titanium, because I like predictability more. And I'm not worried about the metal, because I know it's highly biocompatible. So, but if you disagree with that and you want zirconium, that's available as well. And I do believe in 50 more years, it'll be probably even better than titanium. I'm sure they'll improve it. Like titanium implants, the shape, the surface treatment, the way they're made, all those things improved, and the success rates improved along with it. And I believe that zirconia will follow the same path. It's just a matter of time. And I believe that probably all implants of the future will be made of zirconium, but not today. Yes? Wait, we're gonna jump around too much. Let's stick with the implants. I know you want to hear about the mercury, but we'll talk about that later. Okay, any more implant questions?
How expensive is that?
How expensive? Implants are really expensive. They're thousands of dollars. Each one is around $4,000.
That's for the whole tooth?
You can get them cheaper because the dentists who do it for a fraction of this cost, they cheat. They use materials that are clones. They use systems out of China, Pakistan, and other countries that have no quality control at all. And you don't know what you're putting in people's mouths. So you could buy things for cheaper. You could buy implants on eBay today. That's fun. So, be careful. You do get what you pay for sometimes, and be careful when you see these deals. I will guarantee you those dentists are not swapping their Mercedes out for a Ford. That's just not happening. They're still making the same money. They're just cutting down their overhead costs. Possibly at the expense of your health. I don't know. Yes?
I heard that some people reject their implants.
Well, no medical procedure is 100% successful. In fact, in the state of New York, if you guarantee medical care, you lose your license. Or at least you have the attorneys from the New York State Education Department call you. You know how I know? Because I guaranteed my work and I put it on my website, and I got the attorney of New York State call me. That was fun. That was a good time. So yes, a percent out of, if you place like 100 dental implants, a few will not work. And there's a million reasons why. Yes, sir. Oh, good question. Right, so something that you guys should all know about, which is important. When you take a tooth out, the bone will heal. But in order to have a dental implant, you need to have a certain volume of bone, like in 3 dimensions. I hate to do this analogy, but it's highly accurate. If you're gonna put a screw into wood, a big fat screw, you have to have a lot of wood around it, otherwise it will snap and crack and it wouldn't work. So you need volume of bone. So what pretty much every study showed, because there was just recently a 30-year retrospective analysis of the literature, and it showed that if you graft the bone with a bone graft material, and there's many different types, but if you graft the bone will heal more predictably than without it. And so bone grafting after tooth extraction, I think, at least in my practice, is mandatory or very important. I'm not going to force you to do it, but the truth is, you are gambling. And if the bone doesn't heal right, you don't get a second chance. Because you have to graft the hole in your bone after the tooth comes out. What's actually cool is today we have a new product. We can take out your tooth, we can process it through a new type of machine, and convert this bone graft, your tooth, your tooth that you took out and would have otherwise thrown away into the biohazard waste bag. You now could grind it, process it, and within 10 minutes reimplant it back into your bone. Because teeth are just much denser bone, made of the same stuff. Teeth are basically modified bone. And so you could re-implant your processed tooth back into yourself without having to use materials that are not from you. If you can't do that, then the next best choice is sterilized processed human bone matrix, which is basically cadaver bone, which sounds kind of icky, but that's what we have now. There's something else being used now, and the literature is like 50-50 on it, is something called platelet-rich plasma or fibrin-rich plasma. You basically take out your blood, you spin it down, and you create like a gel with it, and that can be used as a bone graft material or mixed with it. But like I said, the jury's still out on it. It's a very new technology. It's actually used in other parts of medicine successfully also.
Yeah, if you've had a tooth removed over a period of time, say years and years, that bone that's still there, that may not be
Right. So when you remove a tooth and it's gone for many years, how's the bone? It could be fine, or it could be not fine. And we find that all the time. It's kind of a crapshoot. The bone either healed well and there's enough bone to put an implant in, and sometimes you got to tell the patient, I'm sorry. But there are grafting techniques that are available. The problem is, it's extensive surgery. It's expensive surgery. And it's not always predictable. So if you could avoid it, you should. And the way to avoid it is to do it right the first time, is to do a bone graft when the tooth comes out. Spend the money, invest it, it's a worthwhile investment.
That price that you quoted before, was that for just the post, or is that for
the 4,000 price is for the whole thing. The root, the post, and the tooth. So you walk away chewing. Because that's what you want. You want to chew food. And something you guys should be aware of, we spoke about this earlier, that even if you're missing one back tooth, your digestion is severely compromised. And all of us, all of you sitting here, I am sure, that come to these type of health expos, buy organic and vegan and spend all kinds of money on supplements and good quality food so you can be healthy. Well, if you're missing one back tooth, or you got more than one missing back tooth, or you're missing a lot of teeth, that food that you're chewing is not being digested properly. Now your body's working a lot harder to digest it and not doing a good job because your body's not built to digest partially chewed food. That's not how nature built you. Your body assumes you got all your teeth and you're chewing your food properly. It's not designed for a compromised state like that. So you're undigesting food properly, you're not processing it with because you're lacking your teeth. Then you're swallowing it, your body's working hard, making more acid, working hard, using its resources. And then you're pooping out a lot of it in the bowl because you didn't process it right. Vital for your health. In fact, studies show over and over again that I'm done. Am I getting the thing? All right, I was just been told to stop. So just to really finish up, if you're missing teeth and you care about how long you live and you care about your health and your quality of life, get teeth in your mouth. It'll go a long way in helping you be a healthier human being, which is the reason you guys are here on a Sunday. Okay? Thank you. I do have a booth. Come find me. We'll play hide and seek.
You have another question. You're a very inquisitive guy. I like